Now, states that have legalized marijuana have seen a lot of positive effects. For example, arrests for nonviolent drug offenses have decreased. And not only that, but hey, tax collection has also increased. And now, thanks to legalized medical marijuana, addiction rates for opioids in some of these states have plummeted. So this is great news. Now, this comes from a new study out that shows that increased access to legal medical marijuana has actually decreased the use of opioids for pain management and also correspondingly decreased addiction to those types of drugs. Things like OxyContin and other types of prescription pain medications. Now, according to this study, in states where medical marijuana is legal, hospitalization rates for opioid painkiller dependence and abuse dropped an average of 23%. Hospitalization rates for opioid overdoses dropped 13% on average. So, already, okay, good news on that, right? Less people getting hospitalized for overdoses on pain pills. Awesome. Now, some people, and I don't know why, but some people were worried about hospitalization for marijuana. Well, if the hospitalization rate for these opioid drugs is dropping because more people are using pot, then obviously more people using pot leads to more people in the hospital for pot, right? Right? It's kind of hard to follow that logic, but stay with me here. Now, at the same time, according to the study, fears that legalization of medical marijuana would lead to an uptick in those kinds of hospitalizations proved, quote, unfounded. Unfounded, which means you had no increase, in case that was something that you were worried about. Now, because again, cannabis doesn't really do that. For one, you can't OD on pot. Now, you can OD on painkillers, and a lot of people have died. I have numbers on that, but not on marijuana. That's literally impossible to do that. So in effect, using marijuana seems like it's a lot better for people who need pain management than people on prescription drugs. That's what it seems to be. You have any thoughts on that so far? Or do you want me to get on?
Keep going.
All right, let's go. Now, this study was done by author Yuyan Shi, who is a public health professor at the University of California, San Diego. Now, she said that medical marijuana laws may have reduced hospitalizations related to opioid pain relievers. This study and a few others provided some evidence regarding the potential positive benefits of legalizing marijuana to reduce opioid use and abuse. However, she says they are still preliminary. So they want to do more studies, they would want to do more tests. Now, Dr. Esther Chu, a professor of emergency medicine at Oregon Health and Science University in Portland, said, and she was not involved in this study, but said she was very intrigued. Quote, "It is becoming increasingly clear that battling the opioid epidemic will require a multi-pronged approach and a good deal of creativity. Could increased liberalization of marijuana be part of the solution? It seems plausible. However, she said there is still much we need to understand about the mechanisms through which marijuana policy may affect opioid use and its harms." Well, look, I would say right now, we have quite a bit of science that has already been done, a lot of studies, and at least enough to go forward with decriminalization and rescheduling. Yet right now, it continues to be Schedule 1, which means they say that it's more dangerous than heroin and cocaine and has no medicinal value. Obviously, It seems like it has some.
It has a lot. There's nothing here that I think is anything new. They're just finally bringing up an obvious combat, right? Like this can help with as an alternative to other prescription drugs that actually do have some addiction concerns. You hear about people getting addicted to pain pills all the time.
Absolutely.
Because they had some terrible accident, they got an OxyContin prescription, they got addicted. If they were smoking pot for their pain instead, that probably wouldn't have happened. I don't think there's anything necessarily new here. They're just kind of bringing up an obvious. Part of the reason that pot was declared a Class A in the first place was, other than a really successful propaganda campaign, was also because of the propaganda campaign that was helped out by the pharmaceutical industry. They knew there was less money involved.
Yeah, there's
So, I
also
mean,
racism.
it's, it's just, I mean, our drug policy is so archaic, and now people are pointing out the obvious, uh, the obvious fixes.
Yeah, and again, it's something I don't know if you heard me, but there was a racist element to marijuana criminalization as well. That's why
Yeah.
they changed the name from cannabis, something that the founding fathers used to grow and use. For example, Constitution's written on hemp paper, which is a product of cannabis. A lot of people still probably don't know that, which is amazing. Oh, you know why it's actually not amazing? It's because we don't talk about this enough, especially when it comes to mainstream media. They don't talk about this enough. But then again, when you turn on mainstream media, when you turn on CNN, MSNBC, what are some of the ads that you see on daytime TV? Prescription
You
drugs.
see stuff for pharmaceutical drugs, and you
Yes,
see stuff from the oil and gas company.
pretty much. So you're not going to hear these positive stories about cannabis, about marijuana. Now, let me give you some numbers because this is startling. Now, the opioid epidemic is estimated to kill 91 Americans a day. Those are the numbers that I promised you. 91 a day. How many people died from pot? You want to hazard a guess?
I'm gonna go with zero.
You are correct. Now,
Yeah.
yeah, she study is, you win a t-shirt. If I had any. She study was the fifth to show declines in opioid use or deaths in states that allow medical cannabis. So this is the fifth study that has said the same exact thing, and yet we have Jeff Sessions. Jeff Sessions, who was, you can't be a good person and smoke marijuana. Elections, man, they do have consequences. I'm just saying. Sessions is probably one of the worst people to be in his position as Attorney General. Not only is he racist, but he's also super anti-marijuana. Feels like some of the progress that we've made over the past 8 years is gone.
Well, I don't think it's gone. I mean, the proof's in the pudding. I mean, the proof's in Washington State benefiting from this, Colorado benefiting from this. Here in California, our laws are getting more and more progressive and more lax. Um, I don't think it's gone. I think it's just the people
It feels like it's
in
gone.
well, the people with power are really out of touch with public opinion, more
Right.
so than they have been the past 8 years. So we're dealing with that, which means it might be slowed. But I'd like to think it's far from gone.
Well, I think unfortunately we might see some steps backwards as far as policy goes, but we do have victory on public opinion. Public opinion for legalization is actually at its highest level that we've ever had since we started polling on this issue. So the American people are ready for it, even though if our politicians are far from that. So that is the one good thing. Where I see, us going backward is just federal drug policy, which is a disaster, but I still think inevitable we're going to see legalization or at least decriminalization across the board at the federal level. And that's what we need to see. That's what we need to see. Like,
Yeah, it's inevitable.
yeah, look, we've got to get away from those 1950s drug policies, away from the reefer madness, get with the science that already is out there, that we don't necessarily need more studies to keep telling us what we already know.
Yeah.
We need to start, or I should say, we need to stop putting people in prison for smoking a plant that does have obvious medicinal benefits. And if anything, I think that right there should be the winning argument here, is that, hey, let's stop putting people in prison for it. Hey, everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.